Hi, my name is Dr. Deborah Setter. Welcome to my Peripheral Neuroanatomy course. This video covers the advanced neuroanatomy of the arm. I'm going to teach the entire brachial plexus and cover all of the muscles that can be tested in the upper body. Let's get started.
All right, let's draw the complete brachial plexus. We're going to start again with that fishbone diagram, the V and a line and a V, V and a line. Then our sideways W, the X, and half of a Y. Over here are our nerve roots, C5, C6, C7, C8, and T1. Now we're going to add our branches. This is our dorsal scapular nerve branch. Over here, our long thoracic nerve. And we're going to add 1, 2, 3 branches. 1, 2, 3 branches. And 1, 2, 3. Our musculocutaneous nerve is going to have a branch. Our radial nerve will branch. And our median nerve will branch. Okay, now let's label all these branches. This is our dorsal scapular nerve. This is our long thoracic nerve. This is our suprascapular nerve and our subclavian nerve. Up here, this is our lateral pectoral nerve off the lateral cord. And then down here is our medial pectoral nerve off the medial cord. These two branches, this is our medial brachial cutaneous sensory nerve branch. This is our medial antebrachial, that's forearm in Latin, cutaneous sensory nerve branch. In the middle here, this is our subscapular nerve, our upper subscapular, and our lower subscapular. And then this is our thoracodorsal nerve. Up here, going back to our marmu, this is our musculocutaneous nerve, which is also going to have the lateral antebrachial cutaneous sensory nerve. This is our axillary, our radial, which is going to branch into its superficial sensory, and the posterior interosseous nerve. And our median nerve is going to branch into its anterior interosseous nerve, and then the remainder of the median is just going to continue on. And then last, the ulnar nerve. There we go. Now let's add the muscles. The dorsal scapular nerve will innervate the rhomboids and the levator scapulae muscle. The suprascapular nerve will innervate the supraspinatus and the infraspinatus. The subclavian nerve will innervate the subclavius muscle. The long thoracic nerve will innervate the serratus anterior muscle. The lateral pectoral nerve innervates the pec major, the clavicular head, and the medial pectoral nerve innervates the pec major sternal head. This makes sense. Our sternal is more medial, our clavicle is more lateral. the medial pectoral nerve also innervates the pec minor. Here in the middle, both the upper and lower subscapular nerves innervate the subscapularis muscle, and then the lower subscapular nerve innervates the teres major. The thoracal dorsal nerve innervates the latissimus dorsi muscle. Axillary nerve innervates the deltoid, as well as the teres minor. The radial nerve is going to innervate our triceps, our brachioradialis muscle, our extensor carpi radialis, as well as the anconeus muscle. The posterior interosseous nerve is going to innervate the supinator, as well as the extensor carpi ulnaris, extensor digitorum communis, extensor indicis proprius. In addition, the extensor pollicis longus and extensor pollicis brevis, the extensor digitorum minimi, and the abductor pollicis longus. The musculocutaneous nerve is going to innervate the biceps, the brachialis, and the coracobrachialis. The little memory trick is BBC, biceps brachialis, coracobrachialis. The median nerve is going to innervate the pronator teres, the flexor carpi radialis, the flexor digitorum superficialis, and the palmaris longus muscles. The anterior interosseous nerve branches innervates the flexor digitorum profundus to the second and third digits, the flexor pollicis longus, as well as the pronator quadratus. The remainder of the median nerve innervates the abductor pollicis brevis, the opponents, the lumbricals to the second and third digits, and the flexor pollicis brevis. The ulnar nerve innervates the flexor carpi ulnaris, the flexor digitorum profundus to the fourth and fifth digits, the lumbricals to the fourth and fifth digits, the interossei, both the palmar and dorsal interossei, the abductor digiti minimi, the flexor digiti minimi, the opponens digiti minimi, as well as it innervates the adductor pollicis in the thumb. And there you have it, the complete brachial plexus.
All right, we've drawn out our diagram of the brachial plexus. Let's organize this information into a table. This is a dry portion of the talk, so I encourage you to take handwritten notes along with the information as it's presented. That kinetic movement helps you stay engaged. I'm only going to present the new muscles, so you combine this information presented here with what's presented in the intermediate arm table to have a comprehensive list. I encourage you too to reorganize this information in the way that makes the most sense to you. Last, go ahead and download this PowerPoint and use it to quiz yourself to help retain all of this. Here is my diagram of the complete brachial plexus. And here is my table. I have it organized by the muscle, root, trunk, cord, and nerve, and the muscles I'm presenting are grouped by nerve. So for purposes of EMG, it is important to remember the trapezius muscle, which is tested along with testing the upper body. It's primarily cranial nerve 11, but also gets some C3 and C4. This is innervated by the spinal accessory nerve. Next is the serratus anterior. C5, 6, and 7 combine and form the long thoracic nerve. Next is the levator scapulae. This is C5 to the dorsal scapular nerve. There's also a little bit of C3 and C4 in this muscle. Next is the supraspinatus. This is C5 and C6 nerve roots, upper trunk, suprascapular nerve, primarily a C5 muscle. Infraspinatus, C5 and 6, upper trunk, suprascapular nerve, primarily a C5 muscle. The subclavius muscle, this one really isn't relevant for bedside neuromuscular exam or EMG, but I wanted to include it here for those of you that want a comprehensive table. Next is the subscapularis, same. Latissimus dorsi, C6, 7, and 8 nerve roots, upper, middle, and lower trunks, posterior cord, thoracodorsal nerve, primarily a C7 muscle. Next is teres major, C5 and 6, upper trunk, posterior cord, lower subscapular nerve. Pectoralis major, the clavicular head, C5, 6, and 7, upper and middle trunks, lateral cord, lateral pectoral nerve, primarily C5. Pectoralis major, sternal head, this is C8, T1, lower trunk, medial cord, medial pectoral nerve. Pectoralis minor, this is C8, T1 nerve roots, lower trunk, medial cord, medial pectoral nerve. Teres minor, C5 and 6, upper trunk, posterior cord, axillary nerve. Brachialis, C5 and 6, upper trunk, lateral cord, musculocutaneous nerve. Coracobrachialis, C6 and 7, upper and middle trunks, lateral cord, musculocutaneous nerve, primarily a C7 muscle. Anconius, C6, 7, and 8 nerve roots, upper, middle, and lower trunks, posterior cord, radial nerve, primarily a C7 muscle. Supinator, C6 and 7, upper and middle trunks, posterior cord, radial nerve, posterior interosseous nerve branch, primarily a C6 muscle. Extensor pollicis longus, C7 and 8, middle and lower trunk, posterior cord, radial nerve, posterior interosseous nerve branch, primarily a C7 muscle. Extensor pollicis brevis, C7 and 8, middle and lower trunks, posterior cord, radial nerve, posterior interosseous nerve branch, primarily a C7 muscle. The extensor digiti minimi, also primarily a C7 muscle. Again, this one really can't be tested on bedside or via EMG. The abductor pollicis longus, C7 and 8 nerve roots, middle and lower trunk, posterior cord, radial nerve, posterior interosseous nerve branch, primarily a C7 muscle. Flexor digitorum superficialis, C8 and T1, lower trunk, medial cord, median nerve. Flexor digitorum superficialis is primarily a C8 muscle. Palmaris longus, again, not really relevant for the exam or EMG. Pronator quadratus, C8 T1, lower trunk, medial cord, median nerve, anterior interosseous nerve. Primarily a C8 muscle. Flexor pollicis brevis, C8 T1, lower trunk, medial cord, median nerve. Primarily a T1 muscle. Adductor pollicis, C8 T1, lower trunk, medial cord, ulnar nerve. Primarily a T1 muscle. Flexor digiti minimi, C8 T1, lower trunk, medial cord, ulnar nerve. Primarily T1 muscle. Opponens digiti minimi, C8 T1, lower trunk, medial cord, ulnar nerve. Primarily a T1 muscle. All right, that's the rest of the table. Let's move on to the neuromuscular exam.
All right, so we've drawn out the complete brachial plexus, organized that information into a table. Now let's see it in the context of a neuromuscular exam. Thank you to Dr. Hannah Zell-Fleming for assisting with today's demonstration. So a couple of these muscles are on the back, so I'm going to have Dr. Zell-Fleming turn around for me a little bit. That's perfect. The trapezius muscle, that spinal accessory nerve, you have them shrug up the shoulders. I'm showing it from the back just so you can see the muscle activation. I typically test this when the patient's facing me. Yep, hold it up there. That's the trapezius muscle. It's the spinal accessory nerve, also gets a little bit of C3, C4. Next is the serratus anterior. This is the long thoracic nerve. Ideally, you want to have the patient push up against a wall, and you want to look for winging of that scapula. She has a normal long thoracic nerve, so she does not have scapular winging. Next, go ahead and relax your arms. We're going to test the supraspinatus. This is the first 15 degrees of arm abduction. Go ahead and lift up your arms for me. Like this. I can even see hers activate. Relax, activate. Yeah, you can see that supraspinatus pop out there. So next I'm going to have her lift up her arms like this to test the arm adductors. So go ahead and push down. This is testing the latissimus dorsi as well as the teres major muscles. The latissimus dorsi, it's C6, 7, 8. Upper, middle, and lower trunk posterior cord thoracodorsal nerve. And then also the teres major is a contributor for arm adduction. And that's C5, 6, upper trunk medial cord lower subscapular nerve. All right, now Dr. Zell-Fleming is seated. What I'm going to do is ask the patient to glue their elbows to their side and then push out like this. Yep, push against me. That's testing the infraspinatus. That's C5, 6 suprascapular nerve. Next, I'm going to have them test the pectoralis muscle, and that's having them, rotate inwards like this. This is me demonstrating for the camera. When I'm really testing the pec major, again, this is a strong muscle. I'll really get in there. Yep, go ahead and push. Using my strong back muscles to test her pec muscles. The pec muscle, there's the pec major, pec minor, the clavicular head, the sternal head. When you're doing an EMG, you'll know exactly where you are. For the bedside testing, think of the pectoralis as testing all the nerve roots. Back to the forearm muscles. We've talked about testing the pronator teres. Yep, having the patient rotate their arm inwards. That's the pronator teres, median nerve, C6-7. We also want to test the supinator, so that's twisting the arm outwards. Yep, so I just flip my arms. Go ahead. That's the pronator, supinator. Supinator, that's going to be the C6-7 nerve roots, upper and middle trunk, posterior cord, radial nerve, posterior interosseous nerve branch. All right, now for the thumb. There are a lot of muscles in the thumb. The good news is everything's paired. So we have our extensors, our abductors, and our flexors. For our extensors, there's the extensor pollicis longus. That's radial nerve, posterior interosseous nerve branch. And you also have the extensor pollicis longus. So that's the trick. The brevis does the interphalangeal joint. The longus does the carpometacarpal joint. One of the tricks for testing the extensor, is you have the patient with their hand like this, pop that thumb up to the ceiling. So that's our radial nerve, C6-7. And again, keep that thumb up. So I'm isolating, I'm holding that, so that way I'm just testing that interphalangeal joint. So those are the thumb extensors. Both are C6-7, C7-8, middle and lower trunks, posterior cord, radial nerve, posterior interosseous nerve branch. Next are the abductors. This is our median nerve. We have our abductor pollicis brevis, where the hand's flat, pop that thumb up to the ceiling. We also have our abductor pollicis longus. So to isolate this muscle, you have to have the patient extend their thumb and point it up, not all the way, push it up towards the ceiling. That's the abductor pollicis longus. This is posterior interosseous nerve as well. This is the radial nerve. So remembering, abductor pollicis longus is C7-8, middle and lower trunks, posterior cord, radial nerve, posterior interosseous nerve. Whereas here, our abductor pollicis brevis, that's the median nerve. Last are the flexors of the thumb. So you can isolate here, that's flexor pollicis longus. Whereas here, this is flexor pollicis brevis. Flexor pollicis longus is going to be the anterior interosseous branch of the median. Flexor pollicis brevis, keep it there. That's just the pure median nerve. C8-T1, lower trunk, medial cord, median nerve. Also, the adductor pollicis keeps that thumb tucked into the hand like this, So if I have my hand on a flat surface, trying and pulling it apart the adductor pollicis, this is our ulnar nerve, C8-T1, lower trunk, medial cord, ulnar nerve. The shortcut, the little memory trick here, is thumb flexion, radial nerve, abduction, median nerve, adduction, ulnar nerve. 3 nerves with 1 thumb. Last, let's think about an additional little muscle here in the hand. This is the flexor digiti minimi. Again, you want that hand flat and lift that thumb up. Yeah, there we go. That's isolated. You can even see it activating in her. Go ahead. That's the flexor digiti minimi. That's C8-T1, lower trunk, medial cord, ulnar nerve.